Good day everyone, I'm Joy, and if you still remember me, I was the one who got 2 sessions of ultherapy, and if you've watched the previous videos, you can see the transformation from a round-looking face to a sleeker and more snatched one. And today, I'm about to have a natural-looking nose enhancement without surgery by the one and only Dr. Contessa. This is really perfect for those who want to achieve a natural-looking nose enhancement without surgery. So, before anything else, don't forget to like this video, hit that subscribe button, and click the notification bell for updates.
Good day everyone, welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a follow-up. Let's all welcome back Miss Joy Bondoc.
Hi everyone!
Yeah, so we did a V-contour treatment for her, a combination. We had the Ulthera, the PDO threads, and also the filler on the angle of the mandible, and also some chin filler there. How was it, Joy?
As you can see, Doc, there is really the transformation from a round-looking face
to V-contour.
Bigas.
Correct. Yes. I also noticed it when she was doing the photography a while ago. So it was like how many weeks ago or a month ago?
Yeah,
almost a month ago. Almost a month ago. So we can already see that V-contour on her, a narrower, a lower third of the face with that certain still the definition of the angle of the mandible, and also a very good ratio of this upper part of the lower face and the lower part of the lower face. Yung tinatawag naming 1:2 ratio ng this part and this part, okay? So that is for the lower third of the face. And so right now, she's back. So we can work on the part of the mid-face, the center, which is
the nose.
The nose. So one of the key attraction points of our face, the nose, okay? So imagine, sentrong-sentro ang ilong. Kaya it can give that balance between your upper third and lower third, or even between your eyes and your mouth. So yan yung pang-balance, and it's part of the so-called face profile. When you're like on your profile view, you're taking a picture profile view. So the shape of your nose together with the lips and the chin. So that's the one we're checking on when we're doing like a profile assessment. So the nose of Joy, right? So Joy, I'm just curious. Parang Q&A lang sa beauty pageant. Okay. Why non-surgical and not surgical? Parang Q&A sa ating beauty contest or pageantry. Yan.
Okay, so thank you for that wonderful question.
You're welcome. Okay, yeah.
Okay, so I'm choosing non-surgical because firstly, I want to try first. I want to see if it really suits my face, and if nagfi-fit po siya for the whole face, or tinatawag nating facial harmony.
Right. I was about to mention harmony of the face. Yes, there you go. Yeah. The others kasi are afraid of the surgical cut.
Yes po.
The others don't want the general anesthesia. The others don't want like a scar effect, especially on these sides of the nose. Although right now kasi there's already yung technique that they do that it is hidden sa surgical rhinoplasty, okay? And the others like they don't want an implant inside the nose, and the others are saying like they can reject the implant. So some people have this kind of hypersensitivity reactions. Or the others say they don't really want to alter the looks. They just want to retain the natural appearance of their face. Yan. Actually, the nose of Joy is already beautiful, right? Yan. Maganda na po yung ilong niya. So in the Asian beauty, of course, we Asians, we Filipinos, really have this kind of nose anatomy. So the tip is really rounded and a bit wide here. Or we call it, dun sa basal view, we call it mesorrhine. because there are 3 types dun sa basal view. Leptorhine, the Caucasians, the whites. Tapos the extreme end, the platyrhine, platy, P-L-T-Y. So parang flat.
Yes,
Yun.
no.
And broad. So doon naman sa darker type, yung mga like African nose, tayo nasa center, meso. O, di ba? At least moderate. Okay? Meron naman iba kasi sobrang flat.
Yes,
Okay?
po.
So you just want to make it like very natural and just the right tip projection. So ayan, Joy. We're so excited for your enhancement. Hindi ko masabing yung drastic change,
Yes,
but like a subtle enhancement. We'll show you when CSA Medical Aesthetics returns. And we're back. So, actually right now, we have with us Dr. Roxy, okay, our associate doctor here at the CSA Medical Aesthetics, okay? And she's been taking good care of all my patients. Thank you so much, Dr. Roxy. And we are with Joy.
Yes, po.
So, last time we did a so-called V-contouring for her face, and it's already visible from a round-shaped face to hugis bigas. Yon. So, natin yon, Dr.
Yes, Doc.
Yan. So, ngayon naman, we're working on the center of the face, the center of attraction.
Yes.
Kailangan center of attraction, not center of distraction. Okay? So, the nose.
Yes.
Okay. Now, in the nose, whenever we do the nose assessment, we check on angles, yan, ratios,
Yes.
proportions, the length, the width, right? So, we had a lecture on that, remember?
Yes,
So,
Odo.
non-surgical nose thread lift, yan. So, first, we're checking on this part, the frontonasal angle. Yan. If you look at the, yan, side view, profile view, ideally, like, we want a 130 degrees for women. For men, it's different also.
Yes.
Like, for men, acceptable, like, around 115 degrees, yan. Okay, so we want it 130 degrees here. Now, if you look at the inferior part, dito sa baba, okay, you'll notice a little bit of parang may break, parang may dent, okay? So, we already know about yung mga cartilages, di ba? So, if you go at the tip of the, yan, the cute nose. Kasi a while ago, we were discussing, Doc, bilog talaga ilong ko eh. So, we have a round shape nose. Ikaw, doktora. So, round talaga yung nose tip ng mga Pinoy, ng mga Asians. And pagdating dito sa alar, tinatawag na alanasi here,
Yes,
pagkagawa ka
that's
ng line from the intercanthal area, yan, didiretsuhin mo. Pag lumagpas dun sa lines na yon, ang tawag doon yon, alar flaring.
Flare.
So, wide yung alar natin. Yan. So, if you do the measurements, so dito, frontonasal, tapos yung nasolabial, tapos yung alar width, tapos yung tinatawag na tip projection. So, we can just follow. Sundan mo lang yung mga angles, yan, yung tip projection, i-upturn natin, yan. So,
We respect the anatomy of the
Correct.
patients, no, Doc? Yes.
tama. So,
I-enhance.
para harmonious. You mentioned about harmony of the face. So, balance with the face, balance with the ratios and proportions of the face. One time I was lecturing, they asked me the question, do you always follow ratios and proportions? Although in my practice, I really follow it. I respect the ratios and proportions of the face because beauty is defined as being balanced,
Yes.
symmetrical, ano pa, within the ratios and proportions. So, kung out of proportion na, it's no longer beauty.
Yes,
Diba? Like, for example, yung face ko, malaking-malaki ang lips ko. Yun. Hindi proportion. So, it's anong tawag doon? Disproportionate. Okay. So, makes sense? Yan. Okay, so gawin na natin. Okay, as with any other non-surgical procedures that we do here, of course, we always start with cleaning the area. We did apply a numbing cream kanina. Tapos ngayon, we will also do the numbing with our injection of our lidocaine. Yan. So, doktora, nasal tip lang ako. Usually, I pinch the tip area here and inject a tiny lidocaine there. Yeah. So, Doc Roxy is usually assisting me in my procedures and she's actually doing this. So, for my patients, if I'm not here, you can look for Doc Roxy. Yeah. My technique is her technique.
Yes po.
Yan. So, I make an entry point here as usual dito sa nasal tip. And then, I have this filler, a hyaluronic substance. So, I usually do a combination, okay, filler plus threads. In my practice, when I do the combination filler and threads, it's kind of longer lasting. Mas tumatagal yung effect. So, this is a soft cannula. I'll just glide it in the tissue layer. So, Doktora, do you remember ano ba yung tissue layers ng nose? Naalala mo pa? So, externally, di ba, we start with skin layer natin. Yan. So, sa skin layer, that's layer 1, di ba?
Yes.
Tapos, layer 2, yung tinatawag na superficial fat or subcutaneous
Super
layer.
konti lang.
Yan. And layer 3, yan ang tinatawag na fibromuscular layer. So, we're just infusing a little bit of this material, okay? So, since I'm using a gauge 25, and this is a very, a thick viscous filler. We want a filler in the nose na high G prime, something that will stay and not migrate in other parts of the nose, okay? Because the cannula is just small, so I'm pushing it with great effort. Yan. So, done with the bridge. Let's use our protein threads, polymer threads, okay? So, this is a polydioxanone, okay? And it's kind of like some resistance there because actually, I was noticing the skin of Joy. Joy, sabi ko nga, you had an acne concerns also, right? Yan. So, yung may mga acne concerns, pati sa nose, kakaroon ng mga remnants of the acne. No, Joy?
Yes,
Yun. Mga tinatawag na acne marks. So, karoon ng mga parang adhesions. So, yun. And then, after that, we can already do our tip. So, I'll use the same entry point. Okay, this one here. And use my hyaluronic substance again. So, I have patients who are sharing with me that when they've seen this elevation of the tip, they notice their alars got narrower. So, parang this technique can help also kind of, slim the nose. Okay. Now, Doktora, even the polydioxanone, may study sila na nakakabawas ng fats. Diba, if our tip of the nose is rich with fats, so what's happening is it also will help reduce some of the fat tissues, okay, by 24%, according to studies. So, I have a short na dito and just infuse dito sa my columellar space, okay. So, this is a 38 millimeter. Ideally, you have to really make sure that it's gonna go inside to prevent the side effect of thread extrusion. Yan. We're almost done. So, this area is kind of sensitive. Have you experienced this, Doktora?
Yes po, do.
Yeah, me too. I had already 2 sessions of my nose thread lift. And it was a great experience for me.
It's life-changing, actually.
Life-changing. Made me look a lot younger. So, we've done the non-surgical nose enhancements for Joy. Let's show the result when CSA Medical Aesthetics return. And we're back, so let's show the result to Joy. I'm so excited. Here's our mirror, Joy. You can now check on the natural enhancement of your nose. Right?
Yes po.
It kind of, harmonized that beautiful face. So, center the nose.
It's very natural looking.
Exactly. Even your eyes. Look at her eyes. Yung mga mata niya. Doc, yung mga mata niya parang nangusap bigla, right?
Yes,
Yeah.
Sumama.
And yung mga patients ko, whenever I do nose lifting also, na merong mga sunken under eyes or parang tired look eyes, haggard eyes, when we do that radix projection, biglang yung eyes nila, nawawala yung pagka-haggard look or pagka-tired look.
Magiging live
Parang,
po, no?
na-refresh.
Correct.
And ang ganda ng creation yung pag yung radix mo na project, that angle, like look at the view, tsaka pa slope. So, a feminine nose, slope nose. And you mentioned about Tinkerbell nose.
Yes,
Yan.
Doc.
So, the tip is projected and you just have that right radix height, right radix projection. Not too much, especially for women. So, we still wanna maintain that good slope so that right dorsum projection lang. Dorsum ito, yung bridge ng nose. Right? Tapos ito, yung tip. Ito, alar. Yan. And then, looking at the nasolabial angle, the upturning of this tip of the nose, you upturned it, it's just the right angle lang. So, I needed that. I had my 2 sessions na ng thread injections, basically sa bridge So, I haven't had really the tip projection, yun yung kulang ko. I have to do that too. Okay? Si Doktora sigurong gagawa sa akin. Tingnan natin ang trabaho ni Doc Roxy on Doc Contessa, right?
Oh, for sure.
Yeah, it's just that because my schedules then always fully booked, like
Yes,
lectures
for
here and there, yon. So
You're super busy, Doc.
when I no longer have lectures, yan. I'll have Dr. Roxy po. Don't worry. Papagawa ko po yung nose tip ko kay Doc Roxy. Pero okay na yung height of the radix.
Yes,
Even Doctor has beautiful nose.
Yes. Only Doc Contessa touches my skin.
There you go. So we're so happy for you, Joy. So actually, we only used so we did some filler there and a little bit of our threads. Like I just used 5 here and 2 here, and it's already good. Actually, I even asked Joy if she wants it higher. Do you want it higher? Tama ka na.
This time po okay pa naman
Yes.
po.
Yeah,
It's very subtle.
Actually,
Natural.
5 threads lang dito and 2. Because I had patients that I've done more.
17. Doc.
Ayun, a lot. Because Joy naman talaga has beautiful nose na It's not a flat nose. It's just, so we just made like a contouring of the nose lang. Yun lang. Thank you, Joy.
Thank you, Doc.
Parang mas contour na lang po sa
Correct.
makeup.
Any message to our viewers?
Hi, viewers!
Hindi bago pa. Yeah.
Okay, so if gusto niyo rin pong mag-try ng non-surgical nose enhancement here at CSA, this is really perfect for those who want to achieve very subtle lang and natural-looking nose.
Right. Yeah. There you go. So, for cases like Joy, ang type of nose niya, a good candidate talaga for non-surgical nose enhancement. Okay? So, there are cases also that of course, we have to categorize people, the anatomy of the nose. So, we have a lot of people undergoing this non-surgical and they turned out good. Although there are cases that I recommend doing surgery. Depends also dun sa assessment. Okay? Thank you so much, Joy. Doc, any message pala?
For our patients po, they have to take note din that it varies from patient to patient. For Joy, di ba, Doc, it's 5 lang. So, mas maganda talaga magpa-assess kayo and make sure na doctor ang gagawa. Yun lang po ang always reminder ni Doc Contessa. And yun lang po.
And we don't have the same nose again.
Yes.
It varies talaga. It's not like one kind of
one
treatment
size
for
fits
all.
all,
It's
no,
not one size fits all. It's not one type of treatment for all. So it depends on our nose anatomy. Okay? Any social media? They can follow you?
No?
Oh, you can follow me at Doc Roxy. Use half pa.
Yan.
And
Si Joy, alam na natin.
Yes,
Yun na yun. Okay, and also you can follow CSA Medical Aesthetics Instagram and our Facebook page, CSA Medical Aesthetics. So if you have any questions, you may email us at csaskinclinic@yahoo.com. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. And please do watch our other videos. Just look for our channel, Contessa Salvador. So thank you so much. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.